So today we're here, this is a milestone. Today we're here at the Kenyatta National Hospital, and we'll be handing over for clinical trials one of our first machines that has been designed, fabricated and assembled within the Fab Lab at the University of Nairobi.
I'm glad all our partners are here. Those who have traveled wide and far, like my sister here, Katie. Welcome. And karibu sana. Yeah. So I will not take a lot of time. What I'll say is that it has been a long journey of this project. And today, some of us, especially myself, I'm very happy that we are entering into a phase where we have some equipment to do clinical testing. When we started, it was like trying to swim and you don't know whether you're going east or west, but you're in the sea swimming. But this time round, we know at least which direction we're taking, and there is something that we can show for the efforts that have been made by our colleagues at the university, our colleagues from concern, especially the support in terms of finances and all other logisticals to make sure that we have reached this stage. So I'll not take a lot of time. Let me also say thank you very much for all who have cooperated. We have had a lot of meetings, visits, and all that, all geared towards this direction. It has not been a very easy task. Professor Yam must say, kudos, you have been onto this thing. Sometimes we are too busy not to see what's happening, but we can see in the Twitter handle something is happening. So it was very good to keep us posted. So I will give this opportunity. I don't think there's need for self-introduction at the moment. We have introduced ourselves when we are taking eggs out there. And we will keep on interacting, so we'll get to know each other more as we continue with the program today. We don't intend to have a very elaborate program, because I know people are very busy with other many things, and we are still on a journey. So I will take this opportunity to welcome the university team to give us this journey, a snapshot of what is happening before we have speeches. For those who don't know English, look for somebody who speaks English next to you.
I'm quite happy to stand in front of you. Since we're into metaphors and so on, and we were talking about the ocean and swimming, I think the one I'd like to use is we're going up some mountain, and I think we're halfway in terms of having reached this stage. We've got an archive with like lots of photos. We've got lots of reports in terms of how we have reached this far, and we'll be putting that together. I think what is important today is that we want to hand over this initial batch of machines to start that process of clinical trials. And so what I think I'd like to do, first of all, is just acknowledge members of the team who have been working on this project, particularly in this phase. Now you've seen some bits of that video. You saw there are bunches of students, and we've had different groups of students and people working on this over time. And if you heard a bit there, Barnabas was mentioning that this is the 5th iteration of the machine. So we started off quite early. We had the first prototypes, so then went to KEBS, a revision of that. We had students from the School of Design work a little bit on the design features of this before we come up with this version. And just to emphasize, it has gone through KEBS, it has been approved for use now. And what we're hoping out of this clinical trial will be to test it in the water. And after that, we'll then develop now a version which we think will be ready for market. And I think we're just talking with Katie about this whole thing about innovation and the direction in which it goes. For me, one of the singular lessons about this is that it's not as straightforward as people would imagine. On the face of it, it would look very simple to produce this. I think one of the big lessons that will come out of this will not just be that we've demonstrated that we have the capacity to design, but we've done two other things. One of them is around assembly, the identifying who can make this thing locally, because we're talking about designing and manufacturing medical equipment for local use. And it's not just, the university may be able to design it, but then we may not be able to manufacture it locally, and then to repair and so on. So what you're seeing here is a machine that from here on we can make it locally. And so the files that we have developed, apart from the design files, is also the capacity of our local industry to be able to manufacture some of these things. And I think when we move on to that point where we want to now start manufacturing locally and selling locally, that will become really key. And I look forward to that point when we're ready to do that, when now we invite the entrepreneurs to be able to give them not just the machine, but the market and how to do it. So without, not in any order particularly, but Kim in the back, so Ernest Kimani, there's been a lot of work done by Barnabas, and Barnabas, I know you're very tall, so I've done a lot of work on this, including going off industrial area every other day, searching and looking for stuff for the components, designing the mechanical bits of it. Derek is here. I'm sure we all know Derek, doing a lot of work as well. We have Steve, who joined us in the last few months, has been working on this, and I think they represent a bigger group out of the lab, and sitting quietly, looking a little bit stressed, but she's okay, is Sylvia, who has been doing admin on the project. So it's a fairly large team in terms of inputting into this, and I'm sure later on we'll be able to recognize them. The interesting thing, almost the second last point I'm going to make, is that we've also been applying for IP, intellectual property, for this in the project. And initially we just did one big one and said suction machine. But as we've gone on, we've realized that no, that is not the case. So we have two elements in this. There's some components like the vacuum pump that we've just imported also. But then there's been a lot of little design in terms of things that have been made locally and then assembled locally. And so we'll be filing for IP now further for each of those little components. So there will be a lot of IP out of this particular machine. So at this particular point, what I'd like to do, if you don't mind, do you demonstrate now or you want to talk a little bit more?
I think we can talk first and then
we talk first and then. So I think that's on, for me, I'm excited that we're reaching this point that we can now do the clinical trials. And I think I'll be speaking for Dr. Onyecha as well to say this is really the point when now we can begin to talk very well in terms of what it is that we're producing. So this is the first. I'm hoping the lessons that we've learned will now begin to accelerate a little bit. So Mary, we're looking forward now to accelerating the other devices based on what it is that we have learned. So thank you very much.
It's an honor to be here because when this project started in 2012, a year later I took a break from Concern when things were still at inception. We had no idea of the kind of equipment that we would end up with. And so I am glad I am here and I can take credit because I'm now the country director. That I did this. But really, as an organization, we challenge ourselves to push boundaries and look for new ways of doing things. Extend the level of our knowledge and the kind of tools we use to deliver programs. And the Maker project really fits into that. It is very much aligned to who we are and how we do things. And to see the journey of this project to this point has been quite interesting. And it hasn't been fraught with challenges. There were many challenges. At some point, I shouldn't be saying this, but at some point internally, we were questioning whether we should actually be doing this. But there are those who stuck and believed and got us here. And we wouldn't have gotten to this point without the strong partnership that we have with the University of Nairobi and KNH, and also the support from our other partners, UNICEF and Philips, but also to acknowledge the Bill Gates Foundation that actually funded the first phase of the project and provided a lot of the inputs that got us here. So it's a momentous occasion for all of us that we've gotten to this point where we're testing something that is locally designed, assembled, and is now ready for clinical testing. The one group that I would like to really appreciate is the young men and women that have been working on this day in, day out for the last 5 years. Without your efforts, we wouldn't have been here. We can provide as much money as we could have provided, but if you did not stick to the cause and believe that this is something that can be done by young Kenyan men and women, we wouldn't be getting to this point. And this is the unique nature of the Maker project, that it recognizes the potential of the young people and that they are the solution for the many challenges that we face as a country. The mentorship and the training that has been provided through this project has enabled them to believe that anything is possible, but also push the boundaries. And it is as a result of your commitment and belief that we can do something and we can do things differently that we are here today. So with that, I want to say thank you so much for all that have been involved and that have stuck to the cause for this project. We need to give all of ourselves a big applaud for where we are today.
So the first thing you do is make sure it's connected to power. Right? So that's a power cable. The power input is at the back there. It's detachable. So in case you're walking around and you trip on the cable just lets you trip. But yeah. Actually, yeah. So the cable is detachable. So in case of any issues at the back of the machine, it should be safe enough that the machine doesn't fall over and spillage does not occur. Then once you're done with that, then the next thing is you have to set the pressure that you're going to use. So you switch on the machine and you kink the cable right at the tubing between. Wait. Yeah. So and you should kink the cable right at this point here. So
it's the toggle switch. The patient is the pressure release, and that is the negative pressure you get at this end.
And at that point, once you set the pressure, then I think yes, the patient. Oh, you have a patient in a green jacket. There's a patient with I think we can.
The patient.
He's the patient. Yes. We have a patient here in a blue shirt and green.
I'm giving the cup.
Which one?
Patient.
I look more like a doctor.
Once the pressure is set,
Select the
power on, kink to set pressure, use regulator to adjust.
He's pediatric.
Yeah, let me give you.
He's very young.
Yeah, very young.
And once it's
So
done,
now the negative pressure is here. Then move back. In emergency.
Like this one, yeah, it's fitted. Even this one, no? It's easy for me to just do things. I don't have to.
You know, now for us, we can't know at what level do you need the clinicians. We are the ones to tell us, now bring us the clinicians, bring us the biomedical, bring us now at every level.
we have connected the jazz in parallel. The machine is supplied to the jazz connected in parallel, meaning you can only use one jar at a time. And once one fails, you use the toggle switch to flip the input to the next jar. But in the case that you need a lot of volume, that you need the machine to handle a lot of volume, you can easily, and biomedical engineers know how to do that, you can easily connect them in parallel and have the jazz, in series, and have the jazz interconnected so that fluid flows into one, then all the way into the next one. I held on to it for too long. So for the biomedical engineers, there's a maintenance manual. This maintenance manual is derived, first of all, from the assembly manual, but we were using to assemble. It is not the complete assembly manual, but we've derived bits and parts of it that allows you to open up the machine, what is inside, the size of the screws, if you ever need to replace the screws or anything within the machine. This has all those details. It also has details on the standards that were used. All right. Yes. So not the machines, I use the gun.
Thank you very much. Thank you very much. Thank you so much. Thank you so much. Maybe give them another round of applause.
To say we are excited is a statement. Because someone looking at this suction machine will just see an item, an equipment. But as an obstetrician or as a midwife, it has a lot of implications. You see something which is going to save lives. You see something which is going to save our mothers when they're in theater, they need to be suctioned, they're choking on secretions, they're vomiting, you can use it. I see something which I've delivered a baby, it's not scoring, it's not crying, has secretions, the suction, the baby scores, the baby lives. So that's really the story behind this. And that's how important what we are coming up today, that's how important it is. It's not just something which is good to have, but it is something which has a lot of implications. Vis-a-vis, when you look at maternal mortalities, which is very high in this country, perinatal mortalities, all that, neonatal mortalities, this is something which is going to make a difference. And it's something which has been fabricated with our input. So it's something which we know we contributed towards. When I look at the bottle here, I know we have a big problem with what we usually buy. The engineer will attest that the bottles which we have are usually small. You are operating on a patient and you are doing suctioning, she has ascites, a lot of fluid in the abdomen, and you have to keep changing. You have to keep changing because they have a lot of that. But 2.5, that's pretty good with a bonus of 5 liters. But it's really, really commendable. And of course, the mobility. All the features that we see is like no other that we have in the market. And that is a big plus to our partners, to the engineers. Well done for what you've actually worked on so hard to bring here. I had the opportunity to present this in Rio de Janeiro in Brazil 2 weeks ago. That was in the biggest arena for obstetricians, gynecologists. That's the International Federation of Obstetricians and Gynecologists. And we had almost more than 10,000 delegates who came there. And we had the opportunity to showcase what we have here. We had a number of questions. It's how did you come up with it, and where has it reached, and are we using it? And I'm happy that I wish the figure was next week. So I can tell you, yeah, for sure. Now we are using that. So thank you very much. For the manual, we all know what, I don't know whether it's unique for us as Kenyans or it's a human being thing, whereby you have your phone, you buy it, and you never read the manual. Yeah? You switch it on, you find it's not working, then instead of even reading the manual, you call a friend. Say, I have this new phone, and you have an experience with it. But thanks for bringing the manual. I think it has unique features.
It's been a long journey. I think as concerned, one of our key strategies is to strengthen the system. And if we're able to strengthen the system, whether it's public health services or private health services, whether it's at institutional level or it is at the county level, at national level, then we have done it. And so I was just hiding behind the partners because I know that we have walked this journey for several years. One of the biggest achievements from the first phase was to get the University of Nairobi and Kenyatta National Hospital to cooperate and work together and successfully be able to deliver this baby. Initially, we were facilitating the meetings, trying to coordinate. I think the clinicians were not coming to participate in the university events, but now it is now going on flawlessly, which is something and is a joy for us to really appreciate. When I see the first batch of the prototypes, I think I'm home and dry. I think this is it. So I think the next step is to demonstrate outcomes, that these particular devices can be used in a clinical setting. And that brings me to a very important topic that I know, Dr. Maranga, you are very excited for these particular devices to hit the market. We have demonstrated this device in a number of forums, and I can assure you that the counties, they are saying we are having challenges of medical devices. We get donations, they break down. Now we have a good suction machine. Can we buy it? I think maybe there was a time we were demonstrating it in one of the forums, and either Derek or Kimani got a cash offer for the suction machine. That shows you there is a huge need. But before we get there, we have to do clinical testing. And I think we must thank Kenyatta National Hospital. For one, this is now your playground. This is your arena. This is now where you have been waiting for the baby. The baby is here. It has been delivered by Prof. Yes, I'll call you Prof. Whether you invite me for the party or not, I'll still call you Prof. And his team. The baby is here. We have very, very competent, highly technical personnel within Kenyatta National Hospital who are going to lead with clinical testing. And the clinical testing, maybe for the clinicians, will be a prospective study, quasi-experimental, whereby we will be testing how efficient this particular device is comparable to the existing models. The cost effectiveness, for you to demonstrate cost effectiveness, you have to subject it to treating a number of patients, and most importantly, safety. And therefore, the Kenyatta team has meticulously developed an ethics research protocol. It was submitted, it was reviewed by peers and approved. So that is very commendable for Kenyatta National Hospital. And based on that protocol, we will subject these particular devices to the rigor of clinical testing, and we hope that the results will empower the team to move on to the next step, which is now to have a complete medical device prototype where now investment can be made in commercialization. And we'll be home and dry. Maybe in a few years, if the donors allow us, we might be able to set up an industry that is producing suction machines. And I know there are a number of other medical device prototypes that are in the pipeline. So that's what we want. And I think this is a prime moment to invest in healthcare. The president himself has defined healthcare within his agenda. One of the pillars of one of the big, we call them the big four. Not the animals. We used to have the big five. The elephant, the leopard, and I don't know why the leopard was always there because it's a bit small. But within the political agenda of this government, we have 4 agendas. And the most relevant to us is universal health coverage. And we cannot achieve universal health coverage without investing on the supply side. So this is us putting some catalyst towards the supply side. And the other big agenda is manufacture. So I think this is the ideal moment. We hope that the evidence generated from clinical testing can be used to contribute to policy. So let's not just look at these devices, look at the process, look at how we can catalyze manufacture in this country in terms of medical devices, which bears witness to the remarkable partnership and the potential of this particular project. So we'll continue supporting the journey. I think I'll end by just thanking you all, our partners, Kenyatta National Hospital and the University of Nairobi, for this particular investment, and urge you that this is the beginning of the journey, especially for Kenyatta. You have been asking us, where are these things? The things are here.
So this has been an interesting journey, a journey that has taken us about 5 years to get to a point where we have a device that's ready to go for clinical testing. It's momentous because there have been a lot of challenges, but I am glad we had a team that believed in this and provided the necessary support to the young men and women at the university to make sure that we get to this point. And so we're really excited to see that we are at this point and are finally able to use this device in a clinical setting, and hope that the outcome of this phase would inform the next phase of the project, which is fine-tune the device and finally get to a point where we have a device that is ready for commercialization or mass production, and we can start looking at how we market it and what kind of suppliers we can partner with to get to mass production. But it is a momentous occasion in the sense that we have something that has been produced locally, manufactured and assembled locally. So it's indeed something to be proud of in terms of the achievements of this particular project.